Good morning, Senator Stinner and Appropriations Committee members. I am Janet Salehoff, JANET-SEELHOFF. I'm the Executive Director for the Nebraska Association for Home Health Care and Hospice, representing our home health, hospice agencies, and personal care private duty companies across the state of Nebraska. I'm here to testify on behalf of our members to respectfully ask for adjustments in the Medicaid home health and waiver reimbursement rates. We know that it's been at least 10 years since we've come before you and asked for an adjustment. And I have distributed a couple of documents to help give you some data around that. One is, first of all, that we engaged Roger Thompson from Syme Johnson to do a study for us. And he looked at an analysis of what the current Medicaid reimbursement rates are published on the state's Medicaid fee schedule compared to what the actual costs are to deliver healthcare services in the home for Nebraskans. And he also analyzed the rates for waiver. And he looked at 12 agencies across the state, both urban and rural settings, with home health visits ranging anywhere from 3,600 to 65,000. And that was done over the end of 2018 through June of 2019. And as he looked at that, we looked at staffing salaries, travel costs, cost per visit, and overhead, and also factored in a 3% inflation rate. It's important to note that some of our home health patients have been long-time patients. These are individuals that have been getting care for 10, 15, even 20 years. And then we have many patients who get what we would call intermittent services. So for example, someone who's recovering from knee replacement surgery that needs just a few in-home therapy visits. The overall findings concluded that for home health agencies, adjustments are definitely needed in direct skilled nursing. That would be RN and LPN services, as well as our home health aides, physical therapy, occupational therapy, and speech therapy services. And for waiver clients, it would be adjustments in the hourly rate for RNs and LPNs. And we've given some recommended numbers on the spreadsheets to help get to where we need to be to cover our members' costs. We have had numerous discussions with DHHS about this, in particular with Jeremy Brunson, Deputy Director of Finance, and he was kind enough to share with us the utilization rates from 2018 through 2020, and that's also there for you to look at. And what the department has identified is that there is about a $11.1 million gap of where we need to be to cover services. We are asking for that adjustment because we feel like this cost study clearly shows what's required and overdue to serve Nebraskans. We do recognize that this committee has very difficult decisions to make, competing priorities with many healthcare providers, and we know there's limited funding. So we would entertain a phased-in approach that would help us to get to that target over a certain period. For example, perhaps 25% each of the next 2 years to help address that gap. We also understand that DHHS has not performed an internal cost study or analysis of the services or rates, and we are committed to continuing working with them on that and talking with DHHS. I think it's their plan to get back with us in March with at least a high-level look at an assessment and continue that conversation. Most importantly, this is about access to care for Nebraskans. Home health care is the low-cost option for delivery of care in the home. We are seeing an uptick of services across the state. There's no question about that. More and more aging Nebraskans needing the services. Our agencies have higher censuses than they've ever had. So it's a little bit different than what you've heard from some other testifiers. And we are absolutely committed to keeping people independent and safe in the comfort of their homes for as long as it makes sense to do that. And I've got a couple of members behind me that will share more specific examples of the impacts on their agencies, serving everyone from children to the elderly. And I'll be happy to answer any questions that you might have.
Thank you for that question. Senator Wishart.
Well, thank you for being here. And I really appreciate the work that that your association has done in preparation for this. And this is very helpful. Quickly, you mentioned that the department is going to be looking at doing potentially a rate study. Wouldn't that be duplicative to the work that you've already done here?
I think that it will be helpful because we honestly have a lot of questions about the utilization rates that they've shared with us, and we want to have a clear picture of, does this really encompass everything in home health? And if they can also help us forecast what they think the growth will look like over the next several years, that would be very helpful.
Okay, when did you come to the department with this information?
We first met with them October 23rd of last year.
Okay, so what was their reasoning if they believed that an adjustment of 11 million would be needed to address the gaps between the actual costs and the state's current reimbursement rate? What was their explanation for not asking for those dollars this year?
They've simply said they've had a full plate with other priorities.
Okay. And the one other question I have is, when we met, you mentioned, and there may be legislation that's working on this, there have been some issues with requiring like nursing certification for giving somebody a bath that have caused additional costs. I don't know if you wanted to go into that or if somebody can talk a little more to that, but my understanding is that some of the requirements for home health care agencies are troublesome for staff who have done services in the past, because they require a certain level of expertise or certification for something that, am I tracking?
I think you might be referring to our personal care, home care companies that are not required to be licensed for services.
Yes.
And they're very restricted in what they can do in the home.
Okay.
Bathing and some other, what we would call activities of daily living, are
Okay.
things they're able to do. And there has been some discussion with the Public Health Division on whether they may want to move towards licensure requirements for those providers in the future. And we're in the middle of that conversation. As far as home health, licensure is very strict, and so anything that's deemed skilled care has very stringent requirements.
Okay, thank you.
Additional questions? Seeing none, thank you.
Thank you.
Senator, members of the committee, thank you so much for having me today. My name is Sean Balke, spelled S-E-A-N-B-A-L-K-E, and I am president and CEO with a company called Craig Home Care. And I'm here in opposition today of the preliminary Medicaid budget, and in support instead of the reimbursement rate adjustment proposal that the Nebraska Association for Home Care and Hospice has recommended. And really, instead of reading to you, you're going to have my testimony. My really position here today is to speak with you to illustrate some examples in the kind of critical nature of the access to care crisis that exists today for really a specific subset of the Medicaid population. My organization, Craig Home Care, has been providing services, hourly nursing services in Nebraska since 2006. And we specialize in pediatric, very medically complex, very medically fragile cases. We also serve some adults that have similar conditions. Those are typically the aged out cases. They were pediatric cases. They moved to adult cases. And in addition to that specialty, my organization is the only one that focuses on serving rural Nebraska in addition to the urban areas. We certainly provide services in Omaha, Lincoln areas, but we serve every inch of Nebraska. We have cases in Sydney. We have cases in very hard to reach remote places. And our organization has struggled considerably to try to make this model work with that mission of making sure that children that are extremely medically complex, that, as my testimony illustrates, very sick children, very sick adults in some cases that are on medical technology to stay alive. They're on ventilators, they have tracheostomies, they have feeding tubes. Think of it as for pediatric cases, a neonatal intensive care unit in a hospital, right? You look at what that type of level of care is. We're replicating that type of an environment in a home setting so that children that are medically ready, they're stable enough to be able to come home. that they can actually make a transition back to the home and community-based setting where they can be cared for at a much more affordable level than what it costs to keep a patient in an acute care or rehabilitation hospital. And in addition to those benefits to the child in that sense, there's tremendous benefits to the family by not having their child in a long-term care, acute care hospital or an institution of some sort, but having them in the community. You can see a list of some of the services that we provide. We only hire and employ RNs and LPNs in our business, so it's a licensed, skilled, certified level of care. And the crisis that exists is at the bottom of my first page that I'm going to start with. To give you some statistics on what we're facing right now. On average right now, because of the reimbursement rate, it simply has not kept pace. And it's not even with like what other states are doing. It's market conditions that have been talked about already by some other conferees. Market conditions are difficult in the state of Nebraska, and the rates have not kept pace. Competition is very intense, and yet these areas that need service, especially some of the rural areas, simply cannot compete with even the other entities that are out there today that are looking to hire nurses as well. So as a result, only about 51% of the medically necessary and approved authorized service hours, so those are hours that the physician says they need, the state says is okay, the managed care organizations authorize and approve, say this is what they need to be able to come home. Right now, on average, about 51% of those are able to be provided, and that's across the state. You look rural, and rural families are even more impacted. Those numbers drop to 42% or less of the medically authorized services for those patients are able to be provided. Consequences of that are we have children, and I say children because this is the most often initial transition from an acute care hospital. They may sit, they're ready to come home, family's been trained to care for them when we can't, because that's part of the deal when they come home, ready to come home, but because we can't have enough nursing to cover what's needed, they stay there for, we've seen it days, we've seen weeks, we've seen months, and we've seen years where the child sits in an acute care hospital or rehab hospital, ready to come home, but they can't because there's no ability to hire nurses for that service. So that obviously increases tremendous cost to the Medicaid system when those children are sitting in those types of institutions rather than a home care setting. And they also utilize the emergency department utilization goes way up because the families don't have help. They're tired. They have to choose between sleeping, eating, caring for other kids, and they miss a medication dose. They miss a care. These children then have issues. They escalate. They don't notice that there's a symptom of pneumonia potentially creeping in there. Remember, these kids are on ventilators. They don't notice it. Child escalates, goes to a hospital. When they go to a hospital, they don't go for a day or two. They're there for weeks or months sometimes with those conditions. So it's tremendous cost to the system. So the cost savings on the second page of my testimony, I indicate some examples. We've done some work to understand what the DRG or daily.
Sean, the red light's on.
Oh, it is. I'm so sorry. I'll wrap up. Gives you an idea of some of the cost differences between $2,600 to $4,800 a day for a hospital. Us about $550. Huge difference in cost savings there. When you get to the impact on families and so forth below. It's just you know, if you go to our website, craighomecare.com, there's a video called Kelly's Letter, written by a Nebraska mother who receives these services, tells and shows everything about what her and her family experienced related to caring for a very medically complex child at home. And so thank you for hearing my testimony, and I'll be happy to stand for any questions.
Thank you. Questions? Seeing none, thank you very
Okay,
much.
thank you.
Good morning, Senator Stinner and fellow members of the Appropriations Committee. My name is Lana Wood, L-A-N-A-W-O-O-D. I am the administrator of Home Nursing with Heart in Ralston. My agency provides Medicare and Medicaid skilled services in the Omaha, Fremont, Blair surrounding area. And piggybacking on Janet and Sean, we do mainly adults where Sean does the children. So I'm not going to repeat some of the things they said, just tell you a little bit about the patients we're seeing. In the last 27 years, I've been providing home health care services to Nebraskans, a majority of them Medicaid recipients. Some of these patients I have taken care of for 23 years. These patients are the Nebraskans you see out in the community. They go to work every day. They're in our stores, our schools, our churches. Many are there because a Medicaid home health care agency went to their homes and got them up out of bed that morning. They transferred them, they gave them medications, they fed them, they got them in their mobility devices, and we got them up out of the house for the day. We go back and see these clients again at noon in their workplaces or at their schools and help them with their toileting. We make sure they get their new medications, that they get fed, that they're repositioned to prevent any pressure ulcers. We see these patients again at bedtime to bathe them, to get them back into bed, to make sure all their personal care needs are met. We administer IV antibiotics. We change complicated dressings. We provide strength training. We help them with safe transferring. And we also help them with their mental health issues when they may not otherwise follow through with proper treatment. We teach them how to be more independent in their own settings. We facilitate appropriate communication with their health care providers, which may not happen otherwise. And we prevent inappropriate uses of emergency room and hospitalizations by having a 24-hour on-call RN who can troubleshoot any concerns. Because of our home health care agencies, these citizens have the freedom to live outside the confinements of facilities. The gaps are increasing between what home health services are costing us and what we're being reimbursed. Our skilled providers that we have a lot of options out there, and we want to continue to ensure that home health can provide qualified professionals to our Nebraskans. That's all I'm going to talk about right now. If anyone has any questions, if you have a question about the home health aides, I can see if I can answer that as well.
Any questions? Seeing none, thank you.
Thank you.